In falls, injury to the part of the body that comes in contact with the ground or another hard surface is only beginning of the trauma experienced by the patient. This force is also transmitted to adjoining parts of the body. For example, think of a person who dives into a shallow body of water and strikes his head. Although the head will be injured, the force travels onto the cervical and thoracic spine, very possibly resulting in severe spinal cord injury and paralysis. Similarly, when a patient jumps from a height and lands squarely on his feet, there is trauma to the feet, but also to the ankles, legs, and even the pelvis. Always assess along the path of the energy. It is likely that you will find additional injuries. The general guideline from the U.S. Department of Health and Human Services and Centers for Disease Control and Prevention is that a fall of greater than 20 feet for an adult or greater than 10 feet for a child under age 15 or more than 2 to 3 times the child's height is considered to be a severe fall for which transport to a trauma center is highly recommended. This is a reasonable guideline, but it doesn't guarantee a resulting injury or rule out injury if the fall is less than this distance. It is important to look at all the factors at the scene in combination with the patient's complaint, vital signs, and your physical examination findings. When in doubt, assign a patient a high priority for rapid packaging and prompt transport. Penetrating trauma. Penetrating trauma, or injury caused by an object that passes through the skin or other body tissue, also has characteristics that may help in determining the extent of injury. These wounds are classified by the velocity or speed of the item that caused the injury. Low velocity items are those that are propelled by hand, such as knives. Low velocity injuries are usually limited to the area that was penetrated. Remember that there can be multiple wounds, or the blade may have been moved inside the patient, so there can be damage to multiple vital organs. Medium velocity wounds are usually caused by handguns and shotguns. Some forcefully propelled items, such as an arrow launched from a compound bow or a ballistic knife, will also cause greater velocities than the same items propelled by hand. Bullets propelled by a high-powered or assault rifle at a high velocity. Medium and high velocity injuries can cause damage almost anywhere in the body. Bullets cause damage in 2 ways. 1. Damage directly from the projectile. The bullet itself will damage anything in its path. The damage depends on the size of the bullet, its path, and whether it fragments, in other words, breaks up into smaller projectiles, with the fragments taking different paths. The path of the bullet, once it is inside the body, is unpredictable, since it may be deflected by bone or other tissues onto a totally different course. There is often damage to organs and tissues that are not in a straight line between the entrance and exit wounds. Pressure-related damage, or cavitation. This means that the energy of the bullet as it enters the body creates a pressure wave that causes a cavity considerably greater than the size of the bullet. This cavity is temporary, but it may damage items in its path. Blunt force trauma. Blunt force trauma is injury caused by a blow that strikes the body but does not penetrate the skin or other body tissues. For example, when one is struck by a baseball bat or thrown against a steering wheel. The energy from a blunt force blow will travel through the body, often causing serious injury to and even rupture of internal organs and vessels. The resulting compromise of body functions, hemorrhage, or spillage of the organ contents into the body cavity may have more severe consequences for the patient than a penetrating injury. Yet signs of blunt force trauma are often subtle and easy to overlook. The skin may appear reddened at the site of the blow, but in the pre-hospital setting, the bluish coloration characteristic of a bruise may not have had time to appear. Your main clue that such an injury may exist will often be the presence of a mechanism of injury that could have caused this kind of injury. Identifying the mechanism of injury will help you, as an EMT, Determine what injuries are possible and to treat those injuries accordingly, even if signs and symptoms are not present. Never assume, based on the mechanism of injury, that there are no injuries. Even very minor collisions may cause injuries. Maintain a high index of suspicion, a key awareness that there may be injuries, based on the mechanism of injury. Figure 1114. Bullets cause damage in two ways: from the bullet itself, A and C, and from cavitation, which is the temporary cavity caused by the pressure wave. Nature of the illness. Identifying the nature of the illness for a medical patient serves the same purpose as identifying the mechanism of injury for a trauma patient. Finding out what is or what may be wrong with the patient. To begin identifying the nature of a patient's illness during the scene size-up, you must scan the entire scene. Information may be obtained from many sources. First, the patient. When conscious and oriented, the patient will be a prime source of information about his or her condition throughout the assessment process. Family members or bystanders. These people can also provide important information, especially for the unconscious patient. When the patient is conscious and able to tell you about his condition, however, always consider the information from others who are present. Patients who are disoriented or confused may provide information that is either partially true or even untrue. Use information from all sources to piece the patient assessment puzzle together. The scene. While you are sizing up the scene for safety, make note of other factors that may be clues to the patient's condition. You may observe medications, which you will make a mental note to examine later. You may be struck by dangerous or unsanitary living conditions for this particular patient. This is important to note and mention to the emergency department personnel later.